Hi, everyone. This is Dr. Tammy Patzer, and this is Optimal Health with the sponsor, ReliefNow Laser Methods. And I'm really excited because I have Dr. Bruce Short here with me today. Welcome, Dr. Bruce.
Thank you very much. Great to be here. Very happy to be here.
Great. Well, I'm going to tell everyone a little bit about you, and then we're going to dive into our topic today, which is laser methods, because it seems like it's new, but really it's not. But more and more doctors are using it. So let me just tell everybody a little bit more about you, Dr. Bruce. You are the owner and founder of Recharge Sports Injury Center. And Dr. Bruce graduated from Life University School of Chiropractic in 1999, where he was a member of the men's Division I soccer team. He's been practicing in Northern Virginia for more than 22 years, and he's known as one of the best chiropractors in the area for accurately diagnosing an injury and treating it quickly so that his patients can get back to what they enjoy most. And I take it that most of your patients are in the sports arena from the sounds of it.
Yes.
So Dr. Bruce has worked with a number of NFL players, including the Washington Redskins. He's also worked with competition bodybuilders, Olympic cyclists and runners, and professional tennis athletes and marathon runners. Whether you're a seasoned athlete or you just need quality care, Dr. Short is going to provide a treatment plan that's customized just to you. Herndon Laser Pain Center provides a proprietary, gentle, and painless laser solution to all of your debilitating injuries. And that's what I really want to focus on today, because your theme is to ditch the drugs and skip the scalpel. And I think that's really important because if you're in pain, you really need relief. And from what I understand, you just recently added class 4 laser therapy to your practice. Can you tell me a little bit about that?
Sure. Like you said, I've been practicing for 22 years. I've treated tons of athletes. I also treat the normal everyday person who just goes to work and has their standard back pain or neck pain, whatever it is. But I myself was an athlete. I played lots of sports: basketball, tennis, mountain biking. You name it, I did it. Frisbee, ping pong. I've kind of done it all, and so I wanted to sort of mirror my practice against that. And throughout the years, I have added dry needling, which was a huge success in my practice. I do active release technique, which is manual therapy to break up scar tissue. I have an EPAT machine, also known as shockwave. We use that also for different parts of the body. And so, I looked into the laser and saw that how great the laser was, and what other people were saying about it, and that's why I added that.
Well, I know that with laser, they've actually done like 900 different scientific studies about it, proving that it works, and that there's more than 3,000 different conditions that it can treat. So you brought the class 4 laser into your practice, and you started using it on your existing patients. So what is the reaction that these patients are having to laser therapy?
Well, so far everybody's been pretty happy, especially it seems that the immediate result is that pain relief. They have better range of motion. It's a nice warm feeling. So when they come out of the laser treatment, almost everyone has had a very positive response to it.
So are they reporting like pain relief like upon the treatment, or Is it a couple days later? What is the time frame of all of this?
I would say most of my patients have noticed pain relief right after the session. They walk out to the front desk and they're like, wow, I feel great. I feel better than I have before. So far that I would say most of my patients are saying that they felt relief immediately.
Wow, that's pretty big when you can get drug-free pain relief. How long do these laser sessions last?
It depends on the body part, but usually between, I would say, 5 and 10 minutes. Depends on how much energy we have to use on the size of the person and, color of the skin and that sort of thing, what body part we're doing. But typically between 5 and 10 minutes.
So in 5 to 10 minutes, people are experiencing this drug-free, surgery-free pain relief. So can you talk a little bit about how this class 4 laser therapy works?
Sure. So the cells basically have inside of them chromophores, which are in a weird way like solar panels. And those solar panels absorb the energy from the light. That in turn causes the mitochondria to start producing energy. And when the mitochondria produces energy, it has a whole cascading effect on the cell. So it releases tons of different chemicals. And so not only does the cell get more energy, it starts to produce pain relief, analgesic effects. And again, it's a cat. You have to read the science on it to go through the whole cascading effect that it causes, where it reduces inflammation and takes away pain.
Well, I think that's really interesting because basically, in I guess layman's terms, it works on at the cell level and starts to help rejuvenate whatever is damaged or whatever is going on in that area. So you really are focusing a lot with athletes, I mean, real athletes, and then of course, ordinary people like me. So, of the athletes you've treated, what would you say is a common sports-related injury that you're able to treat with the laser?
So far, we have hit everything from plantar fasciitis, which is foot pain. We do shin splints. I've had several patients with knee tendonitis in the knee that have gotten great results with this after 3 to 4 treatments, almost pain-free in the knee. I'm treating tennis elbow on a few patients right now. We're also using this on hamstring. I had someone that strained or pulled their hamstring muscle. So we've been using it on the muscle itself. Low back pain with sciatica, neck pain, shoulder pain. uh, and actually, I had a volleyball girl with a wrist injury. They thought that she might have had a small fracture in her wrist, but they weren't sure. We did 3 sessions, 3 to 4 sessions with laser on her wrist, and she was completely pain-free and went back to playing volleyball within.
Wow. That's pretty phenomenal. I'm a former volleyball player, so obviously that movement with your fingers and your wrists, and it's really important that you aren't in pain. So, so I'm just listening, and as you were going through all of the different body parts, for that you've been able to treat, and what I think is really cool about what you're saying is that you actually are able to work with existing patients and they're able to report back immediately about their pain relief. So are in the future, are you planning on doing more with your laser therapy, like as a separate part of your business to attract new clients?
Yes. So the next step is we're actually working on our space now, but we're putting the ReliefNow laser method inside of our office. So it will be a separate business where people will come in and still get treated or consulted by me. But then if they decide to do the laser will be by itself. They'll be able to go just do laser by itself.
Oh, so what about people who are coming from other locations If I, let's say that I wanted to come to your office because I know you're the expert, especially if I have a sports injury, can you have patients come in from anywhere in the country or in the world?
Oh, absolutely. And especially from where I am, we have, the airport is 15 minutes away. Well, not even actually, probably 5 to 10 minutes away. We have hotels everywhere around us, restaurants, shopping, everything that you would want or need. We have extended stay hotels, Airbnbs all in the area. So yes, it would be very easy and convenient for you to come in, get the treatment within a 1 to 2 week period. Again, depending on what the injury is and how many treatments we think you need. But yes, absolutely, we take people from out of town.
So that's really good because I know that, if you trust your doctor, you want to be able to, go to them no matter what the situation is. So with laser, are there any people who shouldn't be considering laser therapy?
I don't think so. I would say everyone should consider it. Again, there are a couple of precautions that we would have to take, but obviously we would discuss that either in a consultation or even over the phone if we needed to, if there was any special circumstances. But because sometimes if someone has, let's just say, cancer, or if they're pregnant, if it's in their knee or the cancer is somewhere else, but we're treating their knee, there's no problem with that, right? They're in two separate anatomical areas. So no, I would say anyone and everyone can benefit from laser.
So they should basically make a consultation so that they can tell you whatever the other issues may be related to that. So I know that there's science backing it up. You can do the consultations with people. So if if I wanted to consult with you or make an appointment, what's the best way to do that?
Right now, you could go to our website. You could book something online where you can request an appointment. You can put in the day, time, whatever is best for you. And then typically, my office manager would call and set everything up over the phone just to clarify, make sure that we have the space available or the time available. And then we would have you come in and do your consultation.
And so your website is ReliefNowLaserHerndon.com,
Mhm.
and that has all the information and other Q&As and everything on it, explaining everything about laser.
Yep. On the website, you'll find all kinds of information, news articles, published studies, everything that you can see and learn about laser right from our website.
Okay, great. So did I forget to ask you anything that is important that you would just like to either add or reiterate?
Um, well, no, I think we kind of covered everything as far as using other modalities, because sometimes laser by itself might not do everything that we need it to do. And so, just to know that we're always looking outside the box. We're not just treating the one area. We want to try to treat the person. So sometimes the person may have a nutritional deficit that's causing some of the pain. So we don't just try to treat the pain. We try to treat the person and understand where they're coming from, and sort of treat the whole body at the same time.
I think that's really important to make note of that because it isn't always just about the treatment, but it is about, okay, here you are, a whole person. And like you said, you do the consultation and you do the medical backup and everything to know exactly what's wrong. And that's why you're known as one of the top doctors when it comes to diagnosing and finding the right treatments, is because you do look at that whole person. So everyone go to ReliefNowLaserHerndon.com. And we've been speaking with Dr. Bruce Short, and he is a doctor of chiropractic, and he is in Herndon. So ReliefNowLaserHerndon.com. Thank you so much, doctor.
Thanks, Tammy. Really appreciate it.
Okay, thank you.
Thanks.